The patient is a 4-year-old Hispanic male with abdominal pain and vomit times 1. Onset 4 hours ago. Generalized diffuse abdomen. The duration is since onset, and the patient characterizes the pain as dull. The patient denies any aggravating or relieving factors. The timing is consistent and persistent since onset. The severity is 6 out of 10 per the pediatric FACES scale. The patient's past medical history is significant for nephrotic syndrome diagnosed 5 months ago, minimal change disease, allergic rhinitis. There is no family medical history beside paternal grandfather positive for hypertension. No cancer, no CVD, no diabetes, and no history of nephrotic illness. The patient has no surgical history and no known drug allergies. Home meds include calcium carbonate 300 milligrams by mouth 3 times a day, ranitidine 67.5 milligrams by mouth daily, Orapred 12 milligrams by mouth 3 times a day, which is 2 milligrams per kilogram per day, loratadine 5 milligrams by mouth daily, and fluticasone nasal spray 1 spray in each nair daily. The review of system pertinent positives include decreased appetite, eye swelling, nasal congestion, rhinorrhea, abdominal pain, and vomiting. Pertinent negatives include fever, sore throat, cough, trouble breathing, hematemesis, diarrhea, cyanosis, dysuria, hematuria, decreased urination, headaches, and seizures. The vital signs have been stable. The temperature is 97.5 Fahrenheit. Oxygen is 100% on room air. Heart rate is 109, and blood pressure is 101/70. The physical exam includes the patient is awake, alert, oriented, well hydrated, with some mild edema to the eyelids. Conjunctiva is normal. Mucous membranes are pink and moist. Tympanic membranes are normal. Breath sounds are normal. There's no respiratory distress, no rales, no rhonchi, no wheezing. The heart rate is normal. Rhythm, no murmurs noted. The abdomen is soft, non-tender, no distension. Bowel sounds are normal active, no guarding, no rebound tenderness, and no hepatomegaly or splenomegaly noted. There is also no flank pain, and the skin is normal color, no rashes, and cap refill is less than 2 seconds. Notable lab results for interpretation include a white blood cell of 20,000 and neutrophils 82.8, lymphocytes 9.5. This can be explained by the patient on long-term glucocorticoids causing increased white blood cell count, especially high neutrophils. Hemoglobin is 18.5, hematocrit is 54.3. This can be correlated with hemoconcentration due to change in the oncotic pressure due to low albumin. CMP is normal. Creatinine is normal at 0.18, indicating no renal insufficiency. Albumin is low at 0.9, and calcium is 7.5. Low albumin is significant for the nephrotic syndrome, and hypocalcemia follows the protein excretion, thus the calcium is low. Urine is significant for 300 protein, consistent with nephrotic syndrome. The patient has a differential diagnosis not significant for hypovolemic dehydration, bacterial peritonitis, or renal failure. Diagnosis in primary number 1 is nephrotic syndrome, minimal change disease, ICD-10 is N04.9, hypoalbuminemia, ICD-10 is R77.0, vomiting unspecified is R11.10, and gastritis without bleeding, ICD-10 is K29.70. The plan is to consult Dr. Ranch, the patient's pediatric nephrologist. The outcome of the consultation and recommendations include no recommendation for IV fluids or IV albumin, continue the steroid prednisolone at 2 mg per kg per day, and other home meds, and new prescriptions per Prevacid 15 milligrams per day per mouth for gastritis, and Zofran 0.15 milligrams per kilogram 3 times a day as needed for vomiting. Dr. Ranch adds that the patient should be discharged home and follow up in his clinic tomorrow. The diet discussed for home is clear liquids and then advanced as tolerated to a low sodium diet. The patient and parents were counseled on returning to the ER for continued vomiting, signs of dehydration, including no urine for more than 6 to 8 hours, dry, cracked lips, sunken eyes, or other new or worsening symptoms such as trouble breathing. The parents verbalized understanding, and the patient's discharged home.